Good morning, students. I am Dr. Sumati, Professor of Biochemistry from Sree Balaji Medical College and Hospital. Today, my class is on examination approach. Yes, exam. Do you scare about that exam? Yes. Do exam scare you? Yes. To make the exams easy, this slide will help you. Yes. What's new for you in this medical education? Nowadays, they are telling about CBME curriculum. What is CBME curriculum? It is competency-based medical education. It has been defined as an outcome-based approach to the design, implementation, assessment, and evaluation of a medical education program using an organizing framework of competencies. How is it possible? By way of different type of teaching, learning, and conducting different types of assessments. What are we assessing actually? By performing the competencies, like performing the practical, performing the clinical-based case taking and examination of the patients, all those things we are going to assess. And then assessment in the demonstration room itself in the small group teaching, as well as assessment at the bedside when you are going to the clinical postings. And then communication, teamwork, and sincerity and effortness through your project as well as seminar discussion in the small group discussion. Yes. All competencies are assessed multiple times and in different contexts. These are all work-based assessments. There should be active involvement of you people, students. Now coming to the, what are all the subjects you are going to learn during this course? See, this course, 4.5 years, you are going to learning the knowledge, and as well as you are going to have training for 1 year. So these 4.5 years has been divided into phase 1, phase 2. In phase 3, you will have part 1 and part 2. Okay. Yeah. In phase 1, you are going to study for 1 year. During this period, you are going to study anatomy, physiology, biochemistry, as well as introduction to the community medicine, including family adoption program through village outreach, as well as you will be posting early clinical exposure and ATCOM. This is very, very important. Attitude, ethics, and communication module, including humanities. Okay. Yes. So this phase 1, you are going to study for 1 year. The main subjects you will be facing the university exam will be anatomy, physiology, and biochemistry only. At the end of 12 months, you will be having your university exam. Yes. Regarding phase 2, you will be having pathology, microbiology, pharmacology, as well as community medicine, including family adoption program, as well as forensic medicine and toxicology, introduction to the clinical subjects by posting you in the clinical departments, clinical postings, family visits for family adoption program, as well as ATCOM. In all the phases, ATCOM will be there, because ATCOM, we are giving marks for the ATCOM, which will be included in the internal assessment. Okay. Yeah. So this phase 2, you are going to study for 1 year. At the end of the year, you will be having your university exam. Okay, yes. Next comes to the phase 3. In that, we are dividing into 2 parts, part 1 and part 2. Part 1, yeah, the subjects will be community medicine, forensic medicine and toxicology, and medicine and allied science, allied subjects, surgery, general surgery and allied subjects will be there, pediatrics as well as obstetrics and gynecology, and then family visits for family adoption program, and otorhinolaryngology, that is ear, nose, throat subject, as well as ophthalmology, as well as you will be having clinical postings, and again AdCom will be there. So this part 1 phase 3, you will be learning the subjects for 1 year, and at the end of the 1 year, you will be having your university exam. And then between part 1 and part 2, they are introducing the new one, that is electives posting. This is very, very important. This will be conducted in 2 blocks. So non-clinical, one block will be, the first 15 days will be, you will be posted in non-clinical subjects. And in the next 15 days, you will be posted in the clinical subjects. Okay. So this is different from others because you are going to select by yourself your favorite subject here. They will be giving you opportunities. So you will be selecting your own subject and you are going to learn the knowledge. That is 15 days in non-clinical subjects and 15 days in clinical subjects. So after the part 1 annual exam, before the result, irrespective of result outcome, you are going to learn the elective session. This will be for 1 month. Okay. After this, you will be having, will be posted in the phase 3 subjects. Phase 3, part 2 subjects, that is mainly general medicine, which includes dermatology, psychiatry, pediatrics, general surgery, which includes orthopedics, radio diagnosis, anesthesiology, and third one is obstetrics and gynecology. You will be giving clinical postings here, and as usual, AdCom will be there in this part also. Okay. This is long, you will be having long period, that is 18 months, 1.5 years, which includes the 1 month elective posting also. 18 months, you will be having phase 3, part 2 subjects, including the electives. Okay. At the end of 18 months, you are going to write your university exam, which will be considered as next exam also. So what is the eligibility criteria to appear for the professional examinations, that is university exam? You must have 75% attendance in theory as well as 80% attendance in practical or clinical subjects to appear for the examination. Okay. And there should be minimum of 80% attendance in family adoption program, family visits also, and in elective portions also, you should have minimum 75% attendance. Okay. Yeah. So coming to the internal assessment. Internal assessment, it's not like that they are giving test and you are going score marks like that and all. It should be based on day-to-day assessment. So they will assess your assessment by giving from your assignment, from your seminars you are presenting, and clinical case presentation on day-to-day basis, as well as case study, problem solving exercise, all those things, they will be giving marks, and these will be included in the internal assessment. Apart from this day-to-day internal assessment, you will have regular periodic examinations will be conducted throughout the course. In all the subjects, you will be having not less than 3 internal assessment examination, and both for the theory and the practical test. So 3 internal assessment for theory, 3 internal assessment for the practical. Okay. Yeah. So other than this, you will be given marks for your day-to-day record notebook as well as for the logbook also. So in the internal assessment, students must score at least 50% marks of the total marks combined in both theory and practical, not less than 40% marks in theory and practical separately. So you should score not less than 50% marks of the total marks combined in theory and practical. Why this is necessary? They are not including the internal assessment marks for your university exam. So with this internal assessment marks, 50% marks, if you scored in the internal assessment, you will be eligible to appear for the university exam. Okay. The results of the internal assessment will be displayed on the notice board within 1 week of the test. Regarding university exam, criteria for passing the subject is you should score 50% marks in the university conducted examination separately in theory as well as in practical. For the practical, you will be having either practical test or clinical test. Along with this, they will include the viva mark also. So this is the proposed time distribution of the MBBS teaching and examination schedule for 2025-26 batch. So phase 1 examination, you will be having university exam, you will be having during August 2026, and phase 2 you will be having at the end of 12 months, that is likewise phase 3 you will be having at the end of next 12 months, that is after 36 months after you are joining the course. And phase 3 part 2 exam, you will be having 50 after 54 months after joining your course. That will be that exam result will be considered even for the next exam also. That will be next exam also. Okay. After your completion of the internship, internship will be for 1 year. At the end of 1 year of your internship, you will be having the second step of next examination. So in the phase 1, I told you are going to write university exam for 3 subjects: anatomy, physiology, biochemistry. Each subject you will be having 2 papers, and each paper carries 100 marks. So 200 marks for theory, and practical only 1 paper will be there. So 100 marks for practical. Likewise, physiology, biochemistry, you will be having 2 theory papers, each carrying 100 marks, and 1 paper for practical. Similarly, in phase 2, you will be having pathology, microbiology, pharmacology. Each subject will be having 2 theory papers, each paper having 100 marks, and practical you will be having only 100 mark. Okay. Likewise, phase 3 MBBS part 1, you will be having forensic medicine and toxicology. You will have only 1 theory paper. So theory paper, you will have only 100 marks, and practical also 1 practical you will be having 100 marks. Whereas community medicine, you will be having 2 theory papers. So each paper carries 100 marks. So 200 marks for the theory and 100 marks for the practical. Likewise, otorhinolaryngology, ENT and ophthalmology, you will be having only 1 theory paper and 1 practical paper. So 100 marks for theory, 100 marks for practical. Okay. Yeah. For phase 3, part 2, you will be having medicine, surgery, and obstetrics and gynecology and pediatrics. 4 subjects will be there for the university exam. Medicine, surgery, and obstetrics and gynecology, you will be having 2 theory papers. So each carries 100 marks. So 200 marks for theory papers. Whereas practical, you will have 100 marks. Whereas pediatrics, you will have only 1 theory exam. So only 100 marks for theory as well as 100 marks for practical. For medicine and allied paper, you will have 50% questions from general medicine. You will have psychiatry, also dermatology questions will also be there. Likewise, surgery and allied paper 2. General surgery will have 40% marks. Orthopedics, you will have 40% questions. Anesthesia and radio diagnosis, each you will be getting 10% questions. So you have to prepare each and every one. So for passing criteria in the university exam, it is mandatory to get 40% marks separately in theory as well as in practicals, and combined totally 50% for theory plus practicals. Again, I am telling 50% marks is necessary to get through the university exam, combined theory plus practical. So mandatory to get 40% marks separately in theory and in practicals. So this is the question pattern for your internal assessment as well as for the university exam. That is, you will get 20 MCQs questions. Each carries 1 mark. So 20 marks for the MCQs. In that, 5 questions will be case-based scenario, and 15 questions will be analytical based. So 20 marks for the MCQs, and then long essay question, that is either structured question or case-based question. So each that one question will carry 15 marks. So 15 marks for the long essay question, and then case-based, problem-based questions, 3 questions they will be asking, short notes. So each carries 6 marks. So 3 into 6, that is 18 marks. And second short notes is 4 questions, that is analytical based short notes, including AdCom question. So each question carries 4 marks. 4 into 4, 16 marks. And then third type of short notes will be competency based applied short notes. You will be having 4 questions. Each question carries 4 marks. So 4 into 4, 16 marks. And last one is ultra short notes, that is reasoning type of questions. 5 questions will be asked. Each question carries 3 marks. So 5 into 3, 15 marks. So including MCQs, 100 marks for your internal assessment test, as well as the same pattern will be followed for your university exam. For all throughout your course, for all the subjects, the same pattern will be followed. Okay, yeah. So the practicals will be based on your case presentation in the clinical subjects, OSCE in clinical subjects, OSPE, as well as the practicals in the non-clinical subjects. Sparters will be kept for the practical exams. Charts will be discussed in the practical exams. What is OSCE and OSPE? So there you are not going to answer. The examiners won't ask question for that. The examiners can observe and assess the complete history taking or physical examination skill of you. Okay. So that is OSCE. What is OSPE? The examiners just observe how you are performing the practical test and all. They won't ask questions and all in OSCE. Okay. Yeah. So regarding viva, the students will be assessed by interpretation of common investigation data in the biochemistry, as well as Spartus charts, as well as specimens, as well as how you are interpreting the X-rays, how you are identifying the specimens in anatomy, as well as how you are interpret the ECGs in medicine department. Like this, they will ask questions, as well as the theory questions also will be asked in the viva. So practical and viva will be included in the practical exam. Okay, yeah. Then what else we will give marks? You are worrying about the marks only, no. So for the internal assessment, we are giving marks for the records, for the projects, what you are doing during the small group discussion and seminars. We are encouraging you to present posters as well as papers in the conferences. That will also carry marks. And we used to conduct an online test in the small group discussion, teaching methodology and all. And what are the group activities like seminars, projects, also carries marks. And the most important one is attitude. Attitude, we are giving 4 marks for that. So how your attitude towards the subject, how you are respecting the faculties, how you are how your attitude towards the department, all will score marks. Okay. And then don't worry. Are you ready for the exams? All those things I told, how to achieve the success in examinations. Your proper attitude, that becomes a top priority. You should be respectful to your faculties, and you should be your attitude should be proper, and paying proper attention in the class and during practicals. That's why they are asking 75% attendance in theory and 80% attendance should be there in practicals to appear for the university exam. So you should have proper attention in the class and during practical. This one is very important, creating interest in subject. Then only, because you are going to treat the human beings. Mere passing the exams only is not enough. You have to gain more knowledge. You are going to see rare cases also in your private practice. For that, you have to gain more knowledge other than passing the exam. For that, you have to create interest in the subject. Then only you can gain knowledge. Okay. Then proper learning schedule. See, you have to put the schedule on a daily basis. See, you got 3 subjects in the first year means you have to study all the 3 subjects on the day itself. Okay. So proper learning schedule, you have to put the schedule and read properly. Then only you can achieve success in examination. Studying regularly. You should not think, see, this profession, noble profession you are taking, and this profession is, you have to put 100% hard work in that to gain knowledge. So you have to study regularly. Don't think we can read during the, that is, what is that, study all days and all. 3 months before the exam. Don't do like this. You have to study a lot. So study regularly on daily basis. Try to learn new thing every day. Something new thing every day. Okay. So there should be a regular attendance. Repeatedly, I told frequently 75% theory attendance and 80% practical or clinical subject, clinical attendance should be there. So attending all the exams, that is all the exams means all the internal assessment exams, you should score marks, minimum 50% marks should be there to appear for the university exam. So for that, you must attend all the exams. See, for example, if we are keeping 4 internal assessment test means we will take the average mark of that. It should be above 50%. Okay, then only you will be eligible to appear for the university exam. So attend all the exams. Even we used to keep the formative assessment also. Monthly test used assess the theory classes test as well as the small group discussion. All those tests also you must attend. That formative assessment marks also will be included in the internal assessment. So don't forget to attend all the exams. Okay. So respecting the faculty, that will keep you all the way your career. You will carry this respectfulness throughout your year. That will be reflected in your practice also while seeing the patient. So respect your faculty and manage your time effectively. You should not say, ma'am, I don't have any time to read this and all. So for that only you should put proper learning schedule to maintain your time effectively. Okay. So read on daily basis to achieve success in your exam. So much confusion will be there around you. You have to manage the time. Okay. Yeah. Read regularly, read on day-to-day basis. Good luck. Thank you so much.